The show. Thank you for staying tuned. And yes, we promised to say a bit about gadgets, but we'll do that at the end of the show if we have some time. But just before we get into talking about that, we have a very serious topic, quite heavy, especially if you were following this piece of news last week about a Standard 1 student who came to school with quite the anomaly. He was born with a congenital disorder where his heart was actually outside of his body. And we can actually see this young boy here, very brave of him to actually, try to lead a normal life and all. But it is not something that you see every day, and it is definitely something that requires treatment.
As they say, congenital heart disease, talking about that does strike fear in every parent's heart. But I think there is a silver lining in every cloud. There is treatment, and there is how to manage it if it doesn't naturally solve by itself when the baby is small. So let's say hello to the guest for today, Dr. Hamdan Leman, Senior Consultant for the Pediatric Cardiothoracic Surgeon, Department of Cardiothoracic Surgery, Serdang Hospital. Thank you very much for joining us.
Thank you very much for your kind invitation.
Doctor, just before we get started talking about this, a lot of news about congenital heart disorders has been in the papers lately. That's one of them, basically a boy born with a congenital heart disorder that actually went to school. And we've also been talking about hospitals in Kuala Lumpur widening their services in this area. So what can you tell us about conditions like what we just saw on the screen?
Thank you very much for your kind invitation again. And actually, this condition of congenital heart diseases, unlike to what people perception is, it is quite common. The incidence of congenital heart diseases is about 8 to 10 per 1,000 live births. And when we look at the number of deliveries in Malaysia, for example, 500,000 a year, so we can derive from that we are expecting 5,000 babies a year will have some kind of heart malformation. And out of these, 2/3 we require some form of surgical correction. And that will come up to about 2,500 to 3,000 a year. So basically, this is quite a common condition. And this is actually a structural problems arising from abnormal malformation of the heart. And actually, like what you said, something can be done.
Yes. Maybe you can also share with us a few, what are the most common type of congenital heart diseases there are here?
They come in many forms. Anything, because the heart is a very fascinating organ, and anything can go wrong in the formation of the heart. The simplest one, sometimes we call it a hole in the heart. It's commonly heard.
Yes.
And this is also depends on where the hole is. Whether it is upper chamber, lower chamber, and the implication of it is different. Some will require earlier intervention, and some wait. And there are others that that not compatible with life, that you have to do something very much early on in life. During the neonatal period.
Doctor, we have heard about centers in Kuala Lumpur as well as around the country increasing their capacity to handle situations like this. There have been operating theatres dedicated to pediatric surgeries. So why is this so? Is there a higher instance for some reason of congenital heart disorders?
As I mentioned earlier on, we are expecting about 2,000 a year that require, and the ability of, as we know, IGN, for example, may not be able to cope. And this is the thing that I'm passionate about, that we should provide this kind of service that is available to reach everybody. We know that day in, day out, we will see reports in the newspaper that people, children requiring some form of, surgical treatment. And as you said, other than IGN as being the main provider of this kind of services, me, for example, from the Kementerian Kesihatan, I'm based in Serdang, and there's a serious effort by the government to provide this service in the government sector also. We're starting the program, and the thing about managing the congenital heart diseases is not an easy thing to do. It has to be done properly. As it is now, the 85% or 90% of this lethal condition can be treated. And to achieve this kind of level, whereby with a good outcome, it has to start, it has come a long way, and it has to be done very, very in an appropriate manner.
Okay. Yeah, doctor, about pediatric department or pediatric heart conditions. The misconception is it's just about children, but it's not. It's about children which grow up with congenital disorders.
Correct, you're correct. Because as myself, when we started this studying these services, they call us pediatric cardiac surgeon. But if you look at my patients, they can be a few days after birth, or the oldest it can go to 40, 50 years. Because congenital heart diseases, sometimes they may present very much earlier on, depending on the severity of the malformation. And some of them may have not too bad, that they can carry on towards adult life. So that's why, as you say, it's more appropriate to call this field as congenital heart diseases rather than pediatric cardiac surgery.
Is there any helps from the government in terms of funds? You know, if according to the severity of the particular malformation, if I'm not mistaken, the word itself, is there any funds? Because I think the word managing itself seems to cost a lot for per child, you know, with treatments and so on. Is there any help from privates or, you know, the governments in terms of funds?
I mean, as you are right. I mean, to come up with this kind of services, it is very costly. It is very resource intensive. You have to pool group of expertise to carry on to carry out the services. But as I mentioned earlier on, I'm from the Kementerian Kesihatan, and there's a serious effort by the government to provide this service. That in itself, I think, a good thing, because when you come to the government system, to the hospital, it is actually more or less funded.
Right. And it's a lot cheaper than going private. What about continuous care? Because some instances where patients are born with this disorder, they receive first care, but then there's the continuous care that is something that needs to be carried out for the rest of their lives. Is this also something that they can come to government hospitals to achieve?
I mean, you are rightly so. Also, I mean, said it, because I always tell people that, you know, I will never be out of job or out of patient, because once I've done the cases when they are small, and there's a lifelong care for them into the adulthood sometime. And also some of the cases that we perform surgery will require multiple surgery. So that in itself will, you know, will be seen by us throughout their life. And as I said, it is a commitment. I mean, when we embark on this kind of program, on this kind of services, so we have to be with them throughout their life. And hopefully, I mean, there will be something of that nature to support them all the way.
Doctor, coming back to the earlier case we showed you on the screen, about the brave young boy who actually went to school, normal school, with a condition where his heart was outside of his body. Can he live a normal life? What are his limitations?
This is a very rare congenital anomalies that can happen.
And he survived it.
Well, actually, I brought some visual about it, but it depends on the severity of the maldevelopment, because this is rare in the sense that it could happen in 1 in 10 million kind of thing. In my whole life career, that I've seen this only twice, and most situations they don't survive. And as I said, they were born with it, and usually they couldn't make it, despite the best of attempts that we try to offer. But as I said, in this child, I think I saw about it in the newspaper, and I think it is, I don't know whether the patient has seek medical treatment or not, but I think this is the type what we medically call as ectopia cordis, which is heart that is outside the thoracic cavity, or extrathoracic cordis.
But it's still functioning properly.
Yes, in his case, I think what made him survive the situation is because there's skin lining covering it.
Yeah.
So basically the heart is outside and there's a skin layer covering it. So it protects the heart from infections and things like that, because these are what kill the patient very much early on. And but I suspect that, you know, because there's a strong association with that kind of heart to have intracardiac anomalies. They could be hole in the heart, they could be narrowing or things like that. Because I read in the newspaper that the child is not really well in that sense.
Right.
So the idea, I mean, the way how do we manage this, I think since he has survived 6 years, we have to find out whether there's any intracardiac problem, and that should be treated together with a surgical procedure to put back the heart into the heart cavity.
Can you also advise, Doc, on those who has this kind of disease? You know, I think again, as I said earlier, it does strike fear in every parent's heart, and once you understand it, you know how to manage it, then it's easier. But what are the limitations, as Darren was saying? Let's say if it's a woman, then is she able to handle the stress of birth? Or even, you know, any stress of sports and so on. What are the limitations that you usually advise, depending on the severity again?
On the patient?
Yes, to the patients.
As I said, it comes in many forms, so it has to go case by case basis. But I just want to highlight that nowadays, because there's a lot of advancement, not only in the pediatric cardiac surgery, but also in the prenatal care, because this kind of lesion, sometimes they can detect it intrauterine. And in serious malformation like extrathoracic cordis or ectopia cordis, if it can be detected early, so decision has to be made whether you want to follow on with the deliveries or not. There are, as I said, that 80 to 85% of cases with congenital heart disease can be surgically treated, cured. So this is the beauty about congenital heart disease, that if you can provide the service, you can perform the correction, the patient will survive.
Okay.
Maybe about 10 to 15% may require multiple surgeries, not totally 100%, but about 80 to 90% cure. And 5% is the kind of malformation that is not really compatible with life, despite your serious attempts to cure it. So these are the ones that if you could detect it in intrauterine, so sometimes it is best to decide whether to have the babies or not.
I believe the scan is called the echo.
The fetal echocardiography or fetal sonography, which is nowadays, it's not like what it was before. You can see it properly. You can see not only the sex of the baby, you can also see the heart malformation.
So is this something that's provided to all new mothers or expectant mothers, or is it something that need to seek for?
Well, it is coming. I think it has to be in big centers and big hospitals. The big hospital. I know Sudan we have gynecologist or the OB, the obstetrician that can do this to rule out or to screen babies whether they are okay or not.
How important is it, doctor, to have dedicated operating theatres, dedicated staff who are particularly focused on congenital disorders, rather than just having the normal cardiologists actually treat all kinds of cases?
This is a multidisciplinary approach. It's a team approach. I had this experience of setting up a program of congenital heart services in Malaysia, and I was abroad, and I came back again. And basically, as you said, it is not only resource intensive, because of its complexity of this surgery. You have to have a dedicated, not only OT, dedicated team to handle this. The surgeon, the cardiologist, the anesthetist, and the intensivist to see the whole process of the management. And because we have to benchmark ourselves, because nowadays, even the most complex of congenital heart diseases carries about 10% mortality, 5 to 10% mortality. And if you can't perform to that level of standard, so you shouldn't have the program. So it's very important to have a dedicated team, dedicated setup to handle this kind of situation.
So, doctor, where can we get more information, or where is a center that we can go for to get more source of information?
I think usually when we talk about this, as I said earlier on, IGN has been the main provider of this kind of services, and I think you can get that information.
Oh, okay. These are the cardiovascular service providers.
Yeah, these are the services that is available, mainly showing the cardiovascular services in Malaysia. As we know that the government has set up, I think now we have 6 centers in the KKM, starting from Penang, Serdang, and Johor, Kinabalu, Kuching, and Kuantan. A lot is coming up. But these are mainly cardiothoracic services that cater for adults. They can do the simpler form of correction, but when it comes to more complex cases, then you have to go to a dedicated places.
Like
Mainly
Serdang
like
Hospital.
Serdang is setting up, and of course IGN also.
Okay.
Now, on that note, we'd like to say thank you, Doctor, for coming on board.
Thank you very much for having me.
Heart disorder. It's a pleasure.